team. You know, I've been here a little over a year already, and I can tell you that operations is a pretty great place to work. One of the reasons it's such a great place is because of the four values that we ascribe to: efficiency, quality, courtesy, and safety. Now, you know that our safety briefings, such as this one, are a big part of raising that value of safety around here. In fact, plenty of time, energy, and money is spent in making sure that operations is the safest place to work on campus. Even with that value at play, sometimes accidents do happen. And when they do, we want to make sure that our staff is ready to be able to respond in a way that's calm and effective. And that's what this safety briefing is about, is what do you do when accidents do happen? So this training will help you identify what are the most common accidents and incidents that occur in operations and how to respond, whether it is an emergency situation or even a non-emergency situation. In fact, workplace injuries are surprisingly common. According to the National Safety Council, in the U.S., a worker is injured on the job every 7 seconds. That equates to about 7 million work injuries in 1 year. And this is only for the known injuries. There are some that go unreported altogether, and that means that some never receive the medical treatment or the financial benefits that they need. Well, we've certainly had our share of workplace injuries here at Operations from time to time. We've spent time in other trainings talking about how to avoid certain workplace injuries and incidents, but in this training, I wanted to take some time and focus on what do you do if an accident actually happens to you or especially one of your coworkers. We want you to be prepared. Now, the most common incidents and injuries that happen here at Operations are slips, trips, and falls, impact injuries, and sprains and strains. Now, slips, trips, and falls, those risks are everywhere. And so if we're not diligent, we could end up getting hurt. So this could be anything from tripping on a loose extension cord or slipping on a slick surface like ice, or maybe even falling off of a ladder. And so the types of injuries that could occur with these types of accidents are a broken bone, a rolled ankle, a bruise, or a concussion, or maybe even a combination of these, but you could have more than one. Now, impact injuries, these are the kinds of injuries like smashing a finger, smashing a hand, maybe you smash your hand with a hammer, an object falling or either rolling on top of you, and you could get an extremity caught in machinery. So these are all different types of impact injuries. And this just names a few. But with these types of injuries, some of the things we could be dealing with are bruising, crushed fingers or hands, internal injuries, cuts, etc. And finally, the last common type of injury we have here are sprains and strains. And so these can be caused by overexertion, overextension, repetitive motion, and this can cause things like herniated discs or back spasms, carpal tunnel syndrome, neck pain, etc., and several other things as well. Now, you may witness a coworker experience an accident or an injury, or maybe you come upon someone after it's already happened. You may find yourself in this situation where you need to administer aid until someone more qualified comes along to step in. This is called first aid. When you find yourself in this situation, it's important to stay calm and confident. You may need to take charge of the situation. The first thing you'll need to do is determine how severe the injuries are. In order to make this assessment, you start by asking some questions. Find out what led up to the incident, and ask what happened during the accident. Ask them where it hurts, and then make an assessment on how severe the injuries are. In most cases, you'll find that these situations are non-emergency in nature, and so you should let common sense be your guide. Maybe your coworker has a cut on his finger, in which case all that's necessary is a disinfectant and a Band-Aid. So have someone fetch the first aid kit, or you may have to get it yourself. Or maybe someone slips on the ice, all they need is help getting up. And in other minor situations, which could be varied, all that is really needed is for them to follow up with their doctor. So as stated, let common sense be your guide. In these instances, you want to notify your supervisor immediately, and they will call the safety officer. Even when the accident is not severe and the injury is minor in nature, you want this on file because even though there's not medical problems now, something could flare up later. And it's much easier to get help from workers' comp if the incident is already on file. In fact, you should do this even in near misses, and that way the problem can be addressed and might prevent an injury in the future. Now, in rare instances, a workplace injury does present as severe. And so if in your assessment you determine that you have an emergency on your hands, remember to remain calm. Call 911 or get someone nearby to call for you. Have someone fetch the first aid kit or maybe even an AED machine if the person's unconscious or may become so. Ask questions to ascertain where the injuries are most likely to be, but also do a full body visual inspection to see the full extent of the injuries. Assess the situation to determine how you might help. If the person is conscious, always get permission to render aid. If they decline, just stay nearby until help arrives. If you suspect a concussion in the event of a fall or an object to the head, the best thing to do is keep them as still as possible until EMS arrives. Have them lie down with their shoulders and head slightly elevated. They should move as little as possible. Now, if there's severe bleeding from a cut, a laceration, or a gash, the best thing to do is stop the bleeding. Most bleeds can be stopped by steady, firm pressure, and just hold it until EMS arrives. Now, some departments may have stop the bleed kits that they can use. Now, it's important not to lift the bandage, to look under it to see if the bleeding is stopped, because this could undo any progress that you've made. The only exception to this is with a head injury. You don't want to put pressure on a head injury in case there's a skull fracture. A tourniquet may be necessary in situations where a bleed cannot be controlled, and if the injury is on an arm or a leg. You will tie a tourniquet as tight as you can, just below a joint and as close to the wound as you can get it. Some first aid kits may come with a tourniquet, but it may be necessary to improvise. Now, this only works on arms and legs. You can't put a tourniquet if the bleed is on the body, the torso, or if it's on the head. So in those cases, just continue to apply pressure until EMS arrives. Now, if a person is unconscious, listen for breathing. If there is no breathing, you may consider doing CPR. Even if you aren't trained to do so, because even if it's imperfect, it may provide a better chance than doing nothing. Become familiar with who the CPR certified individuals are in your area, because they may be able to take over until EMS arrives. You probably know that CPR consists of chest compressions and mouth-to-mouth resuscitation. Now, there are some people that are concerned about this second part now that we're living in a pandemic. But no reason to worry. Some first aid kits come with a face shield to protect you or the victim. Or you may just opt out of that part altogether. What you may not know is that mouth-to-mouth is no longer a required portion of CPR. Chest compressions have become the focus, and you can continue those until EMS arrives. The purpose of CPR is to provide oxygenated blood to the organs. Find the proper position on their chest by drawing a line from one nipple to the other. Place the heel of one hand over the center point in that line. Stack your hands and interlace your fingers with the other hand and pull your fingers away from the victim. Keep your elbows straight and position your shoulders directly over your hands. Press down forcefully so that the sternum makes contact with the heart. Provide uninterrupted chest compressions of 100 to 120 per minute until paramedics arrive. That's pretty fast, and you will get tired. If someone else is there, you can take turns. It's common to hear some cracking and popping. Don't let that stop you or cause you to let up. That is cartilage and ligaments giving way to the movement. It's better to keep the heart pumping than worry about any broken ribs. Many are surprised at how firmly you have to press for it to be effective. Now, watch this demonstration to reinforce what we just learned.
If you know continuous chest compression CPR, you'll be able to help.
The goal of using CPR is to move blood through the heart and lungs and the brain. You are pushing down on the breastbone or sternum, compressing the heart between the sternum and the spine, which pushes the blood out. Annie, are you okay?
If there's no response, call 911 or have someone do it for you. Then start hands-only compressions.
Place one hand down, the other hand on top.
Push straight down 2 inches, then allow the chest to return to the neutral position. Do it over and over.
At a rate of about 100 to 120 compressions a minute.
Don't stop, not even to breathe for the victim.
It's more important to give consistent compressions to move blood that is still partially oxygenated until we get advanced care on the scene.
Or until someone else who knows continuous chest compression CPR can take over for you. For the Mayo Clinic News Network, I'm Jeff Olson.
I hope this gives you a good idea of how to do chest compressions. Now, if you are CPR certified, you may opt to use the AED if the heart has stopped. However, if you are not trained, it is not recommended that you use AED. Just continue chest compressions until help arrives. Okay, now it's time for a quiz. Let's reinforce what you've learned already. Number 1, workplace injuries occur every 23 minutes. True or false? That's false. They actually occur every 7 seconds. Number 2, the first thing you should do when approaching an injured person that is moaning on the ground is call 911. That's false too. The first thing you should do is assess the situation and ask if you have permission to administer aid. Only call 911 if it is an emergency. Number 3, if you are applying pressure to a bleeding wound, it's good to stop and look under the bandage. True or false? That's false, because if you remove the bandage, it could undo progress that you've made already. Number 4, if a person is bleeding from the abdomen and you can't control the bleed, you should apply a tourniquet. True or false? Also false. You can't use tourniquets on torsos, only on arms or legs. Tie the tourniquet as tightly as possible, just below the joint and as close to the wound as possible. Now, number 5. I should only do CPR if I am trained in CPR. True or false? That's false. Anyone can provide chest compressions, which is far better than doing nothing. And number 6, chest compressions should be given at a rate of 100 to 120 times per minute and given hard enough for the sternum to meet the heart underneath. True or false? That one's true. Give compressions quickly and press hard enough for the sternum to make contact with the heart, which is deep in the chest. Keep going even if you hear cracking sounds. And number 7, CPR does not require mouth-to-mouth resuscitation. True or false? That one's true. It now focuses on chest compressions, though it is still good to do it if you know how and feel comfortable. So how did you do on the quiz? If you found that you have forgotten a few details, don't worry, because you can go back and watch this video time and time again. Our safety program is designed to prevent incidents from happening in the first place. And we are counting on you to practice the safety strategies to help keep us safe. Now, that's how we keep our incidents low. But sometimes accidents do happen, and so we want you to be ready and to know what to do. You know, it's smart for you to determine where your AED machines are. Where's your first aid kit? In fact, where's the nearest fire extinguisher? It's important to find this information out now before you need it. In fact, there is a document attached to the training email that came with this link that will help you figure that out. Complete the form with where all of these situations are, and it will even provide a way for you to find out who in your area is CPR trained so that you can call on them when needed. Post it, laminate it, and go over it with new employees as needed. If you are interested in becoming CPR trained ARO offers in-house classes for just $30. We offer a class every month. So just get your supervisor's approval and contact me and I will get you registered. It is really important that you remember and follow the protocol for contacting your supervisor and reporting these incidents. So contact your supervisor immediately or as soon as you can. They will contact the safety officer, and then more details will come after that as to what to do next. Don't forget that reporting is not just for major incidents. Report all incidences and even near misses. This is critical training. It could mean the difference between life and death for you or a coworker. So spread the word and make sure everyone gets a chance to watch this training. Thank you so much for watching. You're important and you matter. If you have any questions, you can contact me and I'll do my best to get you answers. Have a great day.